This is Dr. Deepa Sharma. I am a consultant neonatologist and a pediatrician, and I work at Motherhood Hospital, Indiranagar, Bangalore. Today, we shall be talking about breastfeeding and its benefits for mothers and babies, and different aspects of breastfeeding and how we can make this journey a successful thing for both the babies and the mothers. Breastfeeding, let me just start about with some basics. Breastfeeding is very much beneficial for the mothers as well as babies. And this is because, first of all, breastfeeding is species specific, which means the milk that is produced is made in such a way that it is useful for the baby, and it provides the right amount of calories, it provides the right amount of protein, fats, and other vitamins for the baby. The breast milk composition is such that this composition of breast milk changes not only during a feed, but also as the baby grows. So see the beauty of nature, that in the beginning of the feed, the baby is thirsty, and that is when the milk which comes out first is to quench the baby's thirst. And therefore, it is rich in water. It is also providing some protein. Whereas at the end of feeding, which is about 15-20 minutes later, at the end of the feeding, the milk, which is called as the hind milk, is rich in fat. So that provides satiety for the baby. Now, not just for nutrition, the breast milk is also economical. You're not spending by buying gadgets. You're not, it's convenient. You don't have to heat it. You don't have to take care of the temperature. It's readily available because if mom is next to the baby, baby can be directly fed, except in some unexceptional cases, like say in case if the baby is sick and is in the ICU, or if the baby is born preterm, and in that case, we cannot directly feed the babies immediately. Not just nutrition, the breastfeeding or the breast milk is also important because it provides a variety of immunological benefits, which means that it is very good in biofactors, which are these bioactive factors also help the babies to get immunity. It helps the babies with, antibodies. It helps babies also provide a good gut strength, and also lining of the epithelium is stronger, which means that it helps protect against illnesses. So, these babies who are breastfed will be having lesser respiratory illnesses, lesser diarrheal illnesses. And later on also, these babies also have, more better cognitive development, which means their IQ is higher than babies who are formula fed. Also, these babies who are breastfed have a very good bonding and attachment with the mothers. So these are some of the benefits of breastfeeding for the babies. Now, when it comes to the mothers, how does breastfeeding help mothers? Breastfeeding is very useful because, first of all, immediately after delivery, when we let the baby suckle at the breast, what happens is there is a release of oxytocin and prolactin. Now, how these hormones help? It will help in contraction of the uterus and helps there, and also there will be less bleeding post delivery. So it is immediately providing a benefit to the mothers. Also, the mothers who tend to breastfeed have, we've seen that there's lesser chances of obesity. The mothers tend to get back to their pre-pregnancy weight much faster. There are also long-term benefits because of these hormones which are secreted during breastfeeding. And that is that the mothers have more protection for their bones, so lesser chances of osteoporosis, lesser chances of diabetes. Also, there is a long-term impact. So the long-term, we see that the mothers have a protective effect against breast cancer and also against ovarian cancer. So these are the useful things that, which affect both the mother and the baby. Now let's look at a larger picture. Breastfeeding is protecting against illnesses. So you are giving intelligent babies, you are giving healthier babies to the society, you're giving less illnesses, so less burden to the government, to the country, and overall to the whole world. It is more economical, it's more convenient, and obviously a good, healthier children all throughout the world. Now, when I was talking about changes in breast milk and how beautiful science is, see the composition of breast milk, which changes not during a particular feed, but it's also changing as the baby's age changes. So we see that a baby who's born, say preterm, the milk composition is completely different compared to what it is when a baby is born term. So the preterm babies would require more protein. Hence, the breast milk at that age is found to have higher protein. Also, when the baby is now term, or the baby is now turned 3 months, 6 months. So according to the baby's requirements at a particular age, the breast milk composition keeps changing without us even knowing. Hence, it's very important that the babies receive mother's milk till a later age and not just for the first few days of life, because the composition would keep varying according to the baby's needs. Golden hour is the first hour after delivery. And why is this emphasized is because this is the first hour after the baby is born. And so we have to start initiating breastfeed soon after birth within the first hour. So there is a very nice phenomena which is called as breast crawl. So if you immediately place the baby onto the mother's tummy immediately after birth and then let the baby stay there, what we have seen is the baby tends to crawl and reach the mother's breast. And this is a natural instinct of the baby. And how does it reach there? It tries to see sensory development is there. It tries to look at the nipples, which are dark colored, and the vision is guiding the baby. The smell of breast milk is also guiding the baby, and this is helping in the baby's sensory development. Also, it's familiar with the mother's heart sounds, and therefore it goes and tries to reach towards the baby mother's chest. So in the first hour itself, if we start feeding, it's not just beneficial because you will give the baby liquid gold, which is the first vaccine of the baby, which is colostrum. So the first few drops of milk which are secreted are very dense, and it is dark yellow in color, which is known as colostrum. And this is very less in quantity, but it is nutri-dense. Okay, so it is very little, but it has a lot of benefits, and it is the first vaccine your baby receives because it's very rich in antibodies and immunoglobulins, and there are a lot of factors which are useful that are entering to the baby right at birth. Also, this will help again for secretion of the hormones, and therefore the breast milk secretion would initiate, and mother would have lesser chances of bleeding post delivery. Hence, it's very important to let the baby suckle at the breast immediately after delivery within the first hour. This is a very common issue which mothers face in the initial part of, when the breastfeeding is being initiated. So effective latching is when majority of the areola is into the baby's mouth while feeding and not just the nipple. So baby should not suckle only at the nipple, which would cause the nipples to become sore and would cause would cause some cracks into the nipple. This would make the breastfeeding a very painful process, and therefore it's important to have a good latch. Now, there may be some issues that the mothers may feel because the baby is not latching, and that could be because the nipples are flat or inverted. Now, if there is a flat nipple, we tend to use, or an inverted nipple, we use a nipple puller, which is a small device which helps to get the nipples out, and then it helps the baby to latch. In some situations, we also use a small a nipple cover, which is called as a nipple shield. And this helps to provide an artificial kind of a nipple for the baby so that the baby can effectively latch on. For these sort of issues should not be diagnosed after birth. So it's very important that in the antenatal visits itself, if the gynecologist and the lactation counselor can see the breast and examine them as well. So these issues are addressed before delivery. Also, there may be issues wherein the mother may feel that she's not too confident. Hence, post delivery, we also have our lactation nurses, we have lactation counselors who would go around post delivery and check on these issues. So before the baby's discharge itself, we try and ensure that these issues are sorted post delivery. So like I mentioned, there could be flat nipples, there could be inverted nipples. There could also be that the baby is, not latching well because you're not feeding the baby on time when the baby is showing you hunger cues. So even though you're, doing everything correctly, but you're not realizing your baby was hungry prior to this. So when the baby is trying and you're trying to put the baby to the breast, that time the baby is frustrated and baby will not latch. So what we need to do is look for hunger cues. And the hunger cues generally would be that the baby is opening its mouth and trying to search for the breast, trying to, put the tongue out, looking for feed, or trying to, do a little bit of a cyclical movement and trying to bring both the fists into the baby's mouth. So these are the hunger cues we need to look for. Now, common breast issues which we find during breastfeeding would be there could be feeling of a lump in the breast, which could be because of improper drainage or secretion of milk from one area of the breast, and which could be because of some smaller ducts which could get blocked. So we generally advise that you should, if such a scenario is there and you feel the breast to feel a little lump in one area, we tend to massage that area of the breast and take a light warm shower, and so that the breast is slightly softer, and then you can massage that area and with your hand while the baby is suckling. So that helps to reduce the lumps. Also, there could be dry and cracked nipples. So post feeding, we advise you can use the last few drops of the breast milk around the nipples, and that helps to give some moisture for the nipples. Also, don't try to use too much of soap and water to clean the breast after each feeding, but because that would strip away the fat and would make the skin more drier. There could be also instances when you're not feeding the baby too frequently, or maybe the whole night you've not fed the baby. In those scenarios, there can be engorgement of breast, and the engorgement of breast would cause the breast to become really hard and really painful. And in some scenarios, the mothers would even get fever and chills. So in this scenario, what we would advise is to take a nice hot shower, and then after that, we let the mother express the milk either manually or using a breast pump. So this would help to relieve the milk which has been engorged into the breast, and after that, the pain would be reduced. Common breastfeeding positions. So what works for you and your baby is the best. 4 or 5, which is the best. So the first one is called as the cradle hold, wherein we would the baby's head would be into the elbow of the mother, and then with the other hand the mother can hold or support the breast and feed the baby. In the other second position is called as the cross cradle hold. In this, you're supporting the baby's head with your palm and not with the fold of the elbow. So with the arm, with the hand, you're holding one hand, with the hand, you're holding the baby's head, and with the other head, you can support and guide the nipple into the baby's mouth. And in both of these positions, the baby's body is lying against the arm of the mother. So the baby is facing towards the mother. Now, in the third position, which is called as the football hold, in this, the baby's head is held on to the in the mother's palm, and but the legs and the body of the baby is lying towards the side of the mother. So uh, towards the axilla and towards the armpit and behind toward. That is how you hold a football kind of a position. Now, the fourth one, which is called as a side lying position, where the baby and mother are both lying in bed, and with the baby's head slightly elevated, the baby is being fed. So these are the commonest positions that we advise the mothers during breastfeeding. Yes, so I wouldn't say harder. So what happens is, after a cesarean section, the mother would have, received some sort of a anesthesia. She's in pain. She's also received some sort of a sedation or a medicine to reduce the pain and to get her to sleep better for some time. So she is basically in a recovery phase. So most of the times, the anesthesia which is given during cesarean is spinal anesthesia. So in that, the mother is actually awake, but she would not feel or the pain or the sensation of the surgery. So after a spinal anesthesia, we have our trained nurses who also do the same thing, which is done after the normal delivery, which is within the first hour. We help the mother to get the baby to breastfeed. So this would be like in a lying down position only, and then with the head slightly elevated, and which is more comfortable. So see, breastfeeding is not just the responsibility of the mother, but all around us, everybody should be supporting the mother. So it is the role of her husband to help her breastfeed, because she's in the recovery stage. She's undergone anesthesia, undergone a surgery. So it is a slightly challenging thing, but we do help the mothers. Days they do get to breastfeed normally. So there are some different positions, like a football position would be more appropriate in case of a cesarean section mother. So just with little bit of adjustment, breastfeeding can be done immediately for even mothers who've undergone cesarean. So we need the support of the family, who would have to help the mother. She would have a urinary catheter in situ. She's had a big surgery there, so a dressing and all. She wouldn't be able to move much. So it's the help from the mother-in-law, her sisters. So breastfeeding is the responsibility not just for the mother, but for the whole family and society also, to encourage all mothers to breastfeed. First of all, I would say that we should not feel guilty, because no mother would, not want the best for her child. Okay. In the most instances, there is a fear, or the mothers do not know whether they are having enough milk. So, what are the things that we need to first reassure them? If these are the things that the baby is having, then they need not worry about low milk supply. So first of all, we need to, when the babies come to the hospital for a checkup post delivery, we check that the baby should have, gained weight. So first, in the first 1 week, we understand, we all know that the baby would lose some weight, which is lesser than 10%. So we keep a check on the baby's weight in the pediatric well baby visits in the first few days post delivery. Now, these things cannot be checked at home. What are the things that the mother needs to check at home is, after a feed, the baby should be passing urine at least 5 to 6 times a day. We should see that the baby sleeps for at least 1.5 or 2 hours post feeding. Also, we should see that during the feed itself, whether the mother is noticing milk into the baby's mouth, and that after a feed, say about 15-20 minutes, the breast should feel a little lighter and softer. If the baby is feeding, sometimes you also may notice milk dripping from the other side. So these are certain pointers which would help you to understand that the milk is enough for your baby. Now, in spite of all this, still we find that the milk is not enough in some situations. So in that case, what we do is we try to quantify the milk. We help the mother express the milk and see how much is the quantity of milk that she's secreting, and whether it is enough for that age. Next thing is, we also let the mother give her some good diet. So there are certain food items which are called as galactogogues, and these help to improve the milk output in mothers. So these are things like using garlic and jeera extra on your rice, or using oats, or certain green leafy vegetables, using dill leaves in your diet. These are certain substances which are known to help with increasing the milk output. We also advise them to see the lactation counselor. So if any additional things can be done, like giving some medications to initiate the breast milk supply. In most of the situations, these are the things which would help. There are very, very rare instances where we have found that, because of some hormonal issues or so, that the mother has not been able to increase the milk output. So the breastfeeding mom would require a good, nutritious, and a balanced diet. We should ensure that she's not restricted on any kind of food items, because there are a lot of traditional beliefs wherein the mothers are given only rice and not given dal, not given non-vegetarian food, and so I would really advise everybody to give, the mothers who are about to breastfeed and who just delivered, they need to recover from the process of birthing. They need to feed the child. So for all of this, she needs to have a good nutritious diet. So please make sure that she's having a good diet, which is inclusive of maybe chapati, rice, which is your cereals, pulses, which is dals, and also if you'll eat non-veg, that is also fine. There is no restriction on that. And also include good vegetables into the diet. In the form of protein source, you can have dals, you can have eggs, you can have chicken. Everything is allowed post delivery. We also advise moms to have a glass of milk or so post delivery, or in during the period of lactation. But please do not go overboard, because it's a myth that if you drink more milk, you will secrete more milk. So this is absolutely wrong. The cow's milk in your body will not convert to breast milk. So please do not go overboard drinking 1 liter of milk and think that you'll start producing more milk. A glass or two is more than enough in the lactation period. This is a new age India where all mothers and are also working, and most of them, if they are in corporates, have a maternity leave of up to 6 months and not beyond. So we need to respect that and help her get back to work, while she should also be able to continue breastfeeding. So it depends on what kind of a work environment you are in. And what we advise is, if the work is a flexible working hours, where she can come in between and feed the baby, go back, or is there a attached place like a creche next to the working place where the baby can be staying, and in between she can feed and come back. Third option is, we start preparing from the 5th month itself, wherein we know the mother has to work a long day and she cannot come back home and feed the baby. In these situations, we ask the mom to start expressing milk and start feeding the baby the expressed milk, so baby gets used to the process of having expressed milk while continuing breastfeeding. It could be that once she goes to work and she comes back, she can continue to directly breastfeed, while before going to work again she can directly breastfeed. Rest of the day the baby can be fed with the expressed breast milk. While at 6 months, we also introduce complementary feeds. So sometimes the baby can be given the solids, and rest of the time when the baby demands milk, expressed milk can be used. Now, this is a topic which has not been spoken about by many people, and this is that what are the conditions where the mothers are at working in a bank, or say working in a airport, or even say working in a government enterprise, or working in a corporate. How many offices offer facilities where the mothers have area where she can store the breast milk, or where she can have a little bit of a privacy where she can express the milk and feel comfortable to do so? After she returns to work, she's going to struggle a little, and that is because she's used to pumping milk every 3 hours, or if not pumping, feeding the baby. So she needs those mini breaks where she can go pump and save the milk for the baby, which can be used later. If not, that will cause a lot of discomfort for her. Later on, as her body gets used to the whole process of not feeding for a particular amount of time, the body realizes, and the amount of milk secreted would kind of reduce. So we need to help these moms by providing facilities like a small fridge where the bottles can be stored. Obviously the pumping equipment would be personal and would be not shared, so it should be the mother's duty to bring it to work. But giving a clean environment and a space like a comfortable sofa, little bit of privacy would go a long way from the side of the corporate offices or any kind. So we find in the airports, say we have a nappy changing room, but are we helping moms or supporting moms by giving them an area to breastfeed? Not many moms are comfortable to breastfeed in public. So even though it's nothing to be, shy of, but it's not comfortable for some moms and they need their privacy. So we need to look at, a more role of a bigger thing like a society, government, or even some corporates where they need to, come out and help to bring this change, which would help mothers to continue breastfeeding while traveling or while even at work. If the mother is directly breastfeeding the baby, there's nothing like it, and this is the first and the best option. However, if the mother is getting back to work, or she's out for a few couple of hours for some work, then second best option is to give the express breastfeed. And express breast milk, if stored properly, will not have any issues. So it is not that it is going to cause any sort of an infection. It is not that the milk would spoil if we store it appropriately. Now, breast milk, if stored in room temperature, can be used for up to 4 hours. If the breastfeed is stored in the refrigerator, in the not into the door shelf, but into the proper shelves inside the refrigerator, we can use it for up to 24 hours. And if the breast milk is stored into the freezer, we can use it for up to 3 to 6 months. Now, when we are expressing the breast milk, we need to make sure the mother washes her hands, either expresses manually or uses a breast pump to store the milk. The milk can be stored in, you get Ziploc milk bags, which are, designed for this purpose. Don't store more than 50-60 ml at a time, because when you thaw the milk and reuse it, you shouldn't be, wasting the milk. Hence, use small quantity of milk for each time that you are preserving. I mean, the storing the milk. Now, once you use the milk, like in room temperature, if you stored for 4 hours, you can just take a milk. You can just take a vessel with hot boiled water and dip the container, like a plastic bottle or a steel vessel, or even the milk bag in which you have kept the milk. You can keep all of that into the vessel which has the hot boiled water, and then warm it, touch it to the back, put 1 or 2 drops at the back of your hand, and then feed the baby. Now, in case this milk is not used or some of it is remaining, please do not use it beyond 1 to 2 hours. In case the milk has been thawed, that is, that from the freezer you have brought it down to a liquid state, from a frozen state to a liquid state, and the milk is now into the refrigerator, please do not refreeze this milk. So once the milk has been thawed, you need to use it by little bit warming it, and I mean warming with the putting it in the vessel with hot boiled water. Please do not microwave or boil this milk directly. So these are the ways. If we appropriately use the express breast milk, we should not be getting any sort of infections, or the milk also will not spoil if we have appropriately stored it. According to the WHO guidelines, we recommend that all mothers should breastfeed babies for a minimum of 6 months before starting solids, that is complementary feeding. Now, weaning, which is, completely going off breastfeeding, would be up to the mother's choice. We generally recommend that up to 2 years or beyond, based on the mother and baby's requirement. But after 6 months, generally, when the baby is able to sit upright, the baby stops drooling a little bit, and when the baby is showing interest in food, these are signs that now the baby is ready to start solids. And that is when we bring the introduction of the complementary feeds. So till 6 months, the babies do not require anything like water, honey, or any other kind of, artificial feeds for the babies. After 6 months, the breast milk is not sufficient, and hence we have to give calorie dense and small portions of meal for the baby in addition to breastfeeding. We are not going to be stopping the breastfeeding. This would help the babies to, provide the nutri gap which happens after the 6 months of age. Now, mothers can follow either traditional way of, introducing complementary feed or the baby-led weaning. Now, in the traditional way of complementary feeding, we used to start babies with purees and, mashed substances like, say, vegetables or fruits or porridges. So everything is basically in a puree consistency, and we would feed the baby. And then gradually go on to, solids, I mean, semi-solids and granular kind of texture, and then go to solid feeding. Whereas in baby-led weaning, what happens is we introduce 3 or 4 different type of food in the baby's plate. Baby is sitting by the side in a high-rise chair next to the family while they are being fed, and not separately fed. And they are taking, they are, exposed to different textures, different smell, different tastes, and then they tend to eat on their own. So it would be like, say, mashed banana or slices of banana, a portion of, say, avocado, a portion of mango, bites, I mean, mango cubes, or say a spoon of oats or ragi porridge. And you leave everything there with the baby, and the baby will tend to play with it, dip the hands and mess up everything. And the baby can, learn which taste the baby is liking, which textures. Baby will explore, the food. Baby will mess up a little. But these are ways that you're developing different tastes and letting the baby explore, like the food, and learn this habit of mouthing, which is taking things from the plate and putting it into the baby's mouth. In this way, the baby decides that when the baby is full and which food the baby wants to eat and which food the baby is not liking. So things like, say, porridge or so are pre-filled like in a spoon and then put there. The baby learns to pick up and, eat with the spoons. This sort of a way of feeding would help the baby, not be too fussy, because you're exposing to too many types of food and a lot of variety on a daily basis. But it needs a lot of patience, because the baby would, sometimes just not eat, only play with the food. But it has its own benefits, because a lot of sensory involvement is there in this sort of a baby led weaning. Now, when we go with traditional weaning, it's more of, the child being fed with a cup and spoon. And so it is, we are not letting the baby see or decide what it wants to eat. So there is a basic difference between the traditional and the baby led weaning. So babies also tend to, pick up and eat or have the pincer grasp around 9 months, where we can give finer finger foods like, say, puffed rice. And this is at a later age. So for the beginning, it can be slices of some fruit or steamed pureed fruit, or it can be even, say, puffed rice. It can be steamed vegetables, which can be given for the baby. So baby-led weaning is a more newer approach for introducing complementary feeding. And in the traditional weaning or the traditional introduction of complementary feeds, it's more we feed the baby. We do not know when the baby is full. So these are the pros and cons of each type of feeding. Breastfeeding is a collective responsibility. It's not that, the fathers cannot breastfeed. We all know that, but they have an important role. They need to support their wives. They need to ensure that she gets the rest when required. He can help with the other household work. He can help change the baby's nappies, change the clothes. There are many other things that are required in baby care and not just feeding. So the mother needs to be motivated a lot to breastfeed, because it takes a lot from the mother, especially in the first few days post delivery. So providing the support, encouraging, and not, sometimes when the milk is not there, or the baby is a little lower on the weight, there could be a lot of negative criticism that we hear from the in-laws or parents or so. So we need the family to support the mother. Only then she can breastfeed the child. And so there's a lot of support. She can, if the mother has been, like, quite exhausted, it's been 2 to 3 weeks post delivery, it is like 24 hours of only feeding, sleeping, and the whole day and weeks go by. So this is the phase when she can get into postpartum blues, postpartum depression. Hence it's the father's responsibility to, help her cheer up, take her out for a walk sometimes, or the baby can be fed express milk for a couple of feeds, where and mother can take a break and go out, have a time out for some time. So all of this is going to be really useful and, motivating and encouraging for the mother. So if the whole family is supportive, whole family is motivating the mother, only then she will be able to breastfeed.